Hello everyone. Today's video is another Q&A video talking today about weird symptoms that might be related to sinus biofilms, talking about herxing from enzymes, talking about using pharmaceuticals for yeast, and a question about whether it's safe to use certain biofilm disruptors in pregnancy. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if you wouldn't mind taking a quick moment at some point to please like, share, subscribe, and or post a quick comment on the video, I would really appreciate it. So thanks in advance for taking a second to do that. So the first question says, I have a candida history and rosacea in some parts of the face and very often conjunctivitis on one eye, and a little bit of phlegm that's coming out once a week since a year ago. Could this be some biofilms in the sinus? My doctor is treating gut biofilms, helping to eliminate the these symptoms, but it will be necessary to deal with some potential, so I'm kind of translating a little bit here, some potential nasal sinus biofilms that could be connected with the eye too. I know you can't give medical advice. Thanks for paying attention and noting that, but please just tell me your opinion and I'll talk to my doctor about it. So thanks for the question. Yeah, so I've had lots of patients in my practice where there are certain ocular or facial symptoms that wind up being related to sinus issues. And the reason I say that is because we treat the sinuses and those symptoms get better or go away in some cases. So I have seen rosacea linked to that. I have definitely seen conjunctivitis linked to that. And then, yeah, it's certainly, some phlegm issues can be related to that as well. So certainly not every case, but I've definitely seen that in practice. And as was alluded to in the question here, treating gut biofilms can be important, and sometimes treating the gut clears up things in other body parts as well. But if there are sinus biofilms or sinus microbial overgrowth, then that's something that can absolutely not be effectively addressed by just treating the gut. So I've definitely seen that in my practice. So I hope that information is helpful, and I will leave that there. Next question was, can pancreatin 8X make you Herx? So just for context, pancreatin 8X is in my opinion, the strongest over-the-counter enzyme that we can get access to, depending on the concentration of it, of course. I mean, if it was just a little baby dose of it, I suppose it wouldn't do much, but nice robust, like 500 milligram capsules. It's a really good strength of capsule and something that I find to be really, really helpful for digestive support in lots of my cases. So I have had some patients have, I believe that I have seen Herxes from pancreatin 8X before. Generally speaking, the vast majority of patients, even in patients who are very, very sensitive, I find that pancreatin 8X is usually very well tolerated, and in many cases, it starts to help digestive issues quite quickly. Now, not all digestive issues, it doesn't, its best claim to fame in my experience is helping with reducing or relieving gas and bloating. I've had some patients where it's mopped up their chronic diarrhea, like resolved their chronic diarrhea. That's maybe could have been taken a different way, I suppose. Anyways, it has resolved their chronic diarrhea issues, chronic bowel urgency, abdominal pains, sometimes helps with nausea, sometimes helps with stomach pains, and more like upper abdominal pain. So I've seen it help with a lot of different conditions, and of course with there's undigested food in the stool, I've seen it help with that in a lot of cases, or if there are certain foods that are just major triggers like fat intolerance or protein intolerance, it can be really, really helpful. So wonderful, wonderful product. I use it all the time. I have had a small number of patients, though, feel worse from pancreatin, and I've seen it cause increased gas and bloating in a fairly small number of patients. I would say definitely less than 10 anyways. And in those cases, as best I can tell, I think it's probably because of a Herx, because they are like, it just doesn't make sense. They would be having gas or bloating from something that's better, helps to digest your food better. Doesn't make any sense. So unless the person, I suppose, was very sensitive to say like pig-based products, because pancreatin is almost always derived from, well, it is, I believe, always derived from pork, like from a pig pancreas source. One can certainly get pancreas extract from cows and sheep as well, but it's just not standardized to the same extent that pancreatin 8X is, to my understanding. Now, the pancreatin itself, I don't believe is likely actually having a killing effect on the microbes in the gut, but I think that it might be having sort of an indirect Herx effect by digesting the food better than the microbes don't have the food to eat, as much food to eat, so then they die, and then that's where your Herx is coming from. That's what I think is happening. I don't know for sure, but that's what until I hear a better explanation, that's my working theory as to what's happening. So I have seen that happen before. Next question is, do you use nystatin at all for yeast? I know it's a pharmaceutical, but some naturopathic doctors work with medical doctors to get specific combinations for treatment. And just to flesh that out further, some naturopathic doctors practice in places where they're able to prescribe pharmaceuticals. So, maybe a bit of a misconception in some places that naturopathic doctors don't like pharmaceutical drugs, or we aren't able to access them. In some places we can. A lot of us think pharmaceutical drugs are great, or at least that some pharmaceutical drugs are great. My belief is that they are great when used appropriately in appropriate circumstances, and I think lots of them are wonderful, wonderful things. But anyways, little side note. So oftentimes in my practice, I oftentimes do not use or ask patients, because we can't prescribe pharmaceuticals here in beautiful Nova Scotia, Canada. It's very rare that my patients with chronic yeast issues wind up using pharmaceutical adjuncts, because it is just hard for them to get access to them. But quite frankly, the herbal or other non-pharmaceutical options that are out there usually work really, really well. So it's not something that leaves us, we're not really left wanting, pining for those pharmaceuticals, because we usually get good results. Now, I do have patients who are working with nystatin or fluconazole, would be the two most common anti-yeast agents, and that I've seen prescribed, and they can be really great adjuncts. So we're hoping that in the not too distant future we will have access to pharmaceutical prescribing here in Nova Scotia, and when that comes around down the pipe, then I will certainly be recommending some pharmaceuticals for patients, but really more just giving patients options, saying we could use the herbal option, we could use the pharmaceutical option. It'll be nice for those patients to have more access and more options, but some folks prefer not to take the pharmaceuticals. Some folks have drug coverage, so they want to take the pharmaceuticals like this. But they can be very useful, and I have no objection to them whatsoever. Just don't have a ton of experience with them in my patients, because they've generally been challenging to access for the types of cases that I see. And then the last question here is just a question about biofilm disruptors, alpha-lipoic acid, DMSA, and bismuth subnitrate. I have been taking this biofilm disruptor in a low dose for 3 months. I didn't realize I was pregnant. Should I be worried? I feel fine, but thought I would ask here if you could mention anything that comes up in your opinion. Really has helped remove this urinary tract infection. Still down, still, I think, some symptoms left. I think there was some autocorrect that affected that question, but yeah, so of course I can't give any direct advice over social media, but so to my knowledge, alpha-lipoic acid and bismuth are two agents that are not known to be teratogenic. They're not known to be harmful to growing embryos, fetuses. So it's something where we don't prescribe those in pregnancy, because we don't have large-scale trials that have been definitively proven that they are safe to use, but especially at low dosages. I mean, if my wife became pregnant, then I don't know what we would do, because we've already got 3 kids and we don't want any more babies. But if my wife became pregnant and she had been on a low dose of a biofilm disruptor, I would not be concerned about the I wouldn't be thinking, oh my gosh, like this poor growing baby, this is not good. So I would not be, if it was in my wife, I would not be concerned. With the DMSA, same thing. My understanding is that they have done some animal studies with DMSA and pregnant rats, and have not shown any teratogenic effect. So no birth mutations and things like that. But it, again, not something that we actively pursue when our patients are pregnant for them, but something that, to my knowledge, has not been shown to be dangerous. There are certain natural agents, like say vitamin A at higher dosages, have been shown to induce birth mutations. So it's not to say just because it's non-pharmaceutical, it doesn't mean that it's definitely safe to take in pregnancy. But with those 3 particular agents, I'm not aware of any glaring concerns around those. So that's my 2 cents on that. I will leave it there for now. Any comments or questions, just post in the comment section below, and I will do my best to answer as soon as I can.